where. So if you're a morning person, that's going to be in the morning. If you're a night person, that's going to be at night.
It's almost counter.
It's counterintuitive because I would have thought exactly the
When
opposite.
you're tired from.
Yeah. Well, that's why they run the study. Anyway, additional work is needed to clarify the picture. Okay, so is hypnosis useful in any real sense, or is it just curiosity? To answer this, we're going to look at some applications, clinical uses of hypnosis. And hypnosis has been used to treat a wide variety of medical and psychological problems. See listed there. It's used this way, it's usually called hypnotherapy. It's the application of hypnotic methods as either a primary means of therapy or as an adjunct to therapy. Now its popularity has kind of waxed and waned. It's currently waxing. It's becoming more popular in various types of behavior therapies, for example, treatments for habits or anxiety in behavioral medicine, things like pain and psychosomatic disorders. Hypnosis has been used successfully in treatment of obesity, weight control, suggestions regarding the amount of food to eat, the type of food to eat, ego-enhancing suggestions that help obese patients lose weight, especially if these patients were highly hypnotizable prior to treatment. So in a sense, this would be like kind of retuning their body image, as it were. Hypnosis has also been successful in treatment of smoking, stress, other potentially debilitating bad habits. In the case of smoking, for example, the abstinence rate for patients treated using hypnotherapy is 30 to 40% after a year. That's actually pretty good. But placebo control groups say about 20, and even some of the best kind of medical interventions rarely go above 50. Hypnosis is not effective even as a supplement, though, for all individuals. Okay, it's much more effective in treating people who are highly hypnotizable and for people that aren't. Particularly interesting case is the use of hypnosis to treat pain. This is called hypnosis with analgesia suggestions. And this has been used to reduce pain or pain from activities such as childbirth, which I'm told is just horrible, minor surgery, dental work, which I know is horrible, burns, headaches, arthritis. Again, usually it's more effective for patients who are higher in hypnotizability. Several types of skin disorders, including warts and psoriasis, have been successfully treated with hypnosis.
Question.
Answer.
How far along are the insurance companies in recognizing the use of hypnosis for pain control?
I do not know that, actually. Gregory is shaking his head no, and no.
They're only just barely touching acupuncture now. Okay?
Yeah.
That's an
It needs to be
interesting way of putting that, touching acupuncture.
Right.
Because I know
It's okay, I'm just needling you.
they're taking biofeedback now, which I personally doesn't work at all for me.
Really?
But not for my pain anyway, it doesn't. But maybe just situational there, though. But I would be very interested in hypnosis. I'm in pain all the time, like a lot of people are.
There's a YouTube of a woman that's getting a root canal with no anesthesia at all.
I've done it.
I've heard of those.
I've done it.
I admire those people. You've actually had that with just hypnosis?
But it was self-hypnosis because I was in Saudi Arabia.
Wow.
Because I react very, very badly to anesthesia. And this guy, you know, the shot lasts longer than I ever want to, and I feel yucky. So I told my dentist, go ahead, do it. He said, I cannot do that. I said, go ahead, do it. If I move, just inject me. And I went into another place, okay? I sent myself there for the duration. And it was almost like being somewhere else, and there was this body that I didn't relate to.
Yeah. That's actually very consistent with some of the sociological theories, because the way they say some of this works is you distract yourself, and what you just described is a perfect kind of distraction.
Yes. I was very glad that I did it, because it was almost like I proved myself
After the
to
fact, yeah.
be, you know, if I can do this, I can do so many things. Yes, so it's a trial. So if you're really interested, you can try to do self-hypnosis. And by the way, I was inspired by Cary Grant because he experienced self-hypnosis. And he had a big mole in his face, and he underwent the operation of self-hypnosis.
Without anesthesia?
Yes.
Well, mental imagery works whether you're in
Yeah.
hypnosis or not, but hypnosis allows you to slow those brain waves down where you can get there, which normal waking consciousness tends to distract
And
you.
again, I think there's some placebo effect going on too, because if somebody is
Yeah.
being hypnotized, that's in a sense giving them permission to use their
Yes.
imagery in that way, when they might not otherwise believe they can do that.
I
And
was
some
gonna
of
say,
us
is
use the Lamaze method.
I was just gonna
for
ask that
natural childbirth.
question. Is there a connection between Lamaze and
Exactly.
self-hypnosis? I was asking it because my first
I did
wife
it.
did it with 3 children, so,
Yeah.
Apparently, yes.
okay, that was my, thank you.
Yeah, the report that I saw did say childbirth, but it didn't specify Lamaze, but it makes sense that Lamaze, that method would work. Where are we now? In many cases, some of the most most effective hypnotic suggestions are those that imply or suggest some greater blood flow to the affected area. In some Eastern meditative traditions, for example, you're supposed to like breathe into the area that hurts. It's very analogous to maybe sending sort of the extra blood to help, process, pull out the waste products. Many of the studies, though, were flawed in not having control groups and in not considering spontaneous remission rates. The lack of control groups makes it impossible to determine how much improvement is due to hypnosis per se versus how much is due to a placebo effect or some kind of other factor.
I agree. Yeah.
What about in the regression area? The idea that maybe you could get someone who observed something that could be helpful in a crime situation to say, this happened maybe a week or 2 weeks or a month ago, and just say, I'm going to put you back in that situation and you're going to remember in detail everything that you saw. Does that work? Is that viable? Is that...
The short answer, no. The long answer, give me 20 minutes and we'll get to that.
Okay.
I think I should have started at the end. Hypnosis has also been used to treat asthma. The complaints of asthma by the patients are reduced if you look at their subjective reports, but the physiological measures are a little more equivocal about it. Is it really working or not? But if people believe it is, that's good enough in many cases. What else? Aid in treatment of sexual dysfunctions, manic depressive disorders, eating disorders such as anorexia or bulimia, multiple personality disorders, and phobias. So pretty much pick your poison.
And what happens with warts? It just goes away? Interesting.
It's a viral infection, for heaven's sake.
Well,
Your
so
mind, the mind is incredibly powerful though, John.
I guess so.
so has it been used on diseases?
Not that I have seen. I didn't do an extensive search for different diseases. I would guess that yes, it could.
I
Norman,
got
think
rid
it
of a
was.
fibroid tumor and a ganglion cyst and a keratosis growth on my skin by using a meditative state, which we could call self-hypnosis, visualizing the shrinkage or the curl. The keratosis didn't work by just seeing it shrink, but I visualized it like an elm leaf on a wet concrete, drying up. I used that kind of image.
Oh, very good.
And the edges of it began to curl up, and the next thing I know it was gone. It just kind of broke away.
Interesting.
Was it like Norman Vincent Peale, I think, who did the sort of laugh yourself to health, the idea about how, if you sort of make yourself happy and think you're happy, your body will heal itself.
Well, I don't know what he said, but what I tried, the stuff I'd heard and read, Malcolm Maltz wrote Psycho-Cybernetics back in the 60s. And that was where I first got the idea that you can visualize something and create a change. But later I learned more about these kind of processes. I tried them and they worked.
In your case, you were willing to try them. You were willing to accept the fact
And I
that it
knew what
might
to,
work.
I knew what to do.
That's
Many people might not accept that otherwise.
Exactly, yeah.
Yeah, and I knew what to do and I was open to it, so.
Exactly, which a lot of people might not be unless it's in the guise of, some kind of medical treatment
Right.
from
Right.
somebody that has some kind of license.
So you got me trying to remember that MD's name, the medical doctor that talked about laugh therapy. He had cancer.
Either
What's
Norman
his name?
Husband
Not
or
Norman Vincent.
Yeah.
Oh, it was,
Healers.
Yeah.
Bernie somebody, it
no,
seems
was it
like.
cousins?
That's who I thought it was, cousins.
Yeah.
Norman Cousin.
But the sort of the common thread in all of that is
Was that his name?
I
the
can't remember
person's
first.
own
Norman
identity.
Cousins wasn't a doctor.
No.
Oh, he was.
I want to hear more about
Patient.
hypnosis.
Well,
Thank you.
Okay, some of the studies have used appropriate controls, but others haven't. And unfortunately, this is kind of one of the areas where a fringe area where you get people trying to do studies who might not have the appropriate methodological background or scientific training. So we're going to talk about experimental methods now. A lot of the controversy in hypnosis theory involves if hypnotic responses are real or subjects are merely faking it. Now, if you're looking at this strictly medical, clinical applications, you don't really care because the bottom line is the person gets better regardless of if they fake it or not. Okay. But if you want to really kind of understand what's going on, this is something that you need to figure out. And the fact that some subjects might be faking their responses has made it necessary for researchers to develop some special methods to try to root out the fakers. The first of the two methods we're going to talk about is called the high-low method. This involves comparing responses of high hypnotizable subjects with low hypnotizable subjects. Okay. The second method that researchers have used is called the simulator reel. And in this case, the responses of a hypnotized subject are compared with the responses of an unhypnotized subject who has been instructed to act as if he were hypnotized. In other words, to fake it. So you're comparing a person who's really hypnotized with someone who's faking it. Here's the logic. If the simulators, or the fakers, respond exactly like the real hypnotized subjects, then the responses of the reals might be due to, looks like, some kind of compliance or faking, rather than to, hypnosis per se. I have to emphasize, might be due. If the responses of the reals and the simulators are different, many researchers reject the possibility that the real subjects faked it. But if the responses of the simulators and the reals don't differ, you're not justified in concluding that the reals did fake it, only that maybe they could have. It's possible the simulators may have lapsed into a self-induced trance, or the effects of hypnosis on a given response don't significantly change a particular response from waking baseline. Anyway, those are the two methods. Now we're going to look at an example of each method using the same pain stimulus, what's called cold pressor task. Researchers in hypnosis love this. In this test, the subject's hand and forearm are immersed in ice water. Try this sometime. It's actually more painful than you might think. The experimenter periodically asks subjects to report how much pain they feel. And they respond with a number that rates the pain. Typically it's a 0 to 10 scale, sometimes it's 0 to 20, where either 10 or 20 would be severe pain. Now the cold pressor task has some advantages. One is that the pain that's produced doesn't damage the subject in any way. It's completely reversible. A second advantage is that the cold pressor task can produce pretty severe pain in a relatively short time. Now, in one experiment using this test, subjects were tested under one of three conditions. Okay, one was the control, and these subjects didn't have any kind of hypnotic suggestion or any kind of analgesia suggestion, just kind of their normal waking consciousness. The second condition was hypnosis alone. Now, these subjects were hypnotized, but there was no mention made of pain control or analgesia. Okay, it's just standard hypnosis induction. And the purpose of this condition was to see if hypnosis alone produced maybe a significant relaxation or other change that could produce the analgesic effects. The third condition was the hypnotic analgesia. In this condition, subjects were hypnotized and they got a suggestion for analgesia, okay, that there would be no pain. And you can see the results here on the right side of the slide. The top is low hypnotizable and the bottom is highly hypnotizable. The x-axis on each graph is the amount of time that the hand was in ice water. Along the y-axis is the verbal estimate of pain. Well, the first thing you'll notice is for both the low and the high, the longer the hand was in the water, the more painful it felt. Okay, those lines are going up. That's not really surprising. In the low hypnotizables, the top graph, there really wasn't much of a difference between the people that got no hypnotic suggestion, just hypnotic suggestion, or the hypnosis versus, or hypnosis including analgesia. All groups are basically the same. Okay. The three lines are very close to each other. In the high hypnotizable group, there was an effect. So here you have the top two lines here are the groups that didn't get any hypnosis, and the group that got hypnosis, but there was no mention of pain. The group that got hypnosis with a suggestion of analgesia, look at this line down here. They actually seem to be reporting less pain, okay, than the others. Okay, maybe they're faking it. When you do this kind of experiment with a simulated real method, okay, you find that the simulators report a reduction in pain of about 90%. The reals report a reduction of about 77%. So there was a difference between the fakers and the real hypnotizables. So do you believe the real hypnotizables